can raise my voice if needed, and if you would like me to speak in a normal tone, I can do that too. Great. We'll work on it as we go along, but go ahead and make yourself comfortable, okay? Fantastic. You recently had an eye test done here, haven't you? You've had several appointments at this office, but it doesn't really specify which doctor. That's okay. The first thing we start out with in this session is your history and go over your treatment plan, so I'm just gonna go ahead and fold this back up. Something to be reviewed at a later time. Okay, so I do have your chart right here. Just gonna go over it real quick. Some of the sounds I'm using, like that one right there, something that just kind of follows me doing this so often and so frequently. I do apologize. It's actually what's used during the actual process of your EMDR therapy today. But I'm going to go ahead and ask you just a few questions. If you could respond and let me know. Could you say your full name? Kind of silly considering you're in front of me and I do know your name. However, I want to make sure you're as clear-headed or as close to clear-headed as possible for this. Can you recite your birthday for me? Okay. So let's do a little bit of family history. I do want to just give a little bit of a forewarning that this is somewhat of a deep process. The goal ultimately is to help you recover from what you've suffered from, depending on what you're comfortable sharing and what you want to heal from. However, thinking about something that has previously hurt you can be damaging, so please consider that before continuing on with this. Good. Okay. So I'd like to go a little bit over just your family history. And let's start off by... Do you have any siblings? Does anybody in your family have a history of mental illness or anything such as post-traumatic stress disorder, CPTSD, any mental illness such as bipolar disorder, things like that? This isn't necessarily a questionnaire about heart disease or history of stroke. I am going to be doing a quick scan of you, but no, don't worry, I'm going to go ahead and use a little bit, just a little bit of hand sanitizer. Okay. So I'd like to just kind of form a quick treatment plan with you today. This is a very relaxed session, although deep. It's not as intense as something you would actually find once we get a little bit more further in. So I'd like to make a treatment plan with you. I'm going to go over a few things that, again, may be a little bit uncomfortable. So I have a handful of kind of fidget toys, if you will. Something that can help you just kind of expand, like this little guy did. Little. Just to cool off, make you feel better. Can I interest you? Some people find playing with this little click-it, I like to call it a click-it, can be relieving when talking about this. I'll go ahead and put this here for you. also have a stress ball. It is a drop of urine, I do understand. Since we're close to the clinic that often gives drug screenings for work and so on and so forth, we have a bowl of these, so you can squeeze it if this helps you out. Go ahead and put that right over here. And then I also have the human brain. Go ahead and give that a squeeze since we're going to be working on that today. And then, of course, I often have people play with this magic 8-ball. Yes, it has been a moment since I've held a magic 8-ball, but I figured you might find some interest. Give it a shake. Give it a shoo 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 shoo. So EMDR focuses on these sounds specifically, something I'm going to have you bring up now in your treatment plan, and then I'm going to go ahead and prep with you, which I'm going to address your concerns and questions and things like that, prepare you to feel some, discomfort while we move into the actual process. I'm going to assess you, identify what and why, and just do a quick physical, and then we're going to do the desensitization. So why don't you go ahead and focus on the little toys that I did give you, and let's get a new page to start your treatment plan. So you've obviously come here for a reason. And then judging by your past results, it looks like you have, or you do know what EMDR is. Why don't you go ahead and tell me what you'd like to focus on today? And what exactly are you looking to heal from? Or at least start to heal from, essentially something that I can replace negatively with positive. So the very lightest form is, everybody's trauma is different, and I find that a child who unfortunately saw their pet pass away would ultimately like to replace that memory with something that isn't so painful when they think about it. And if I can help replace that negative memory with something positive, then we can help move on from it and essentially forget it completely, or just move on with it completely. So yeah. So do you believe you could focus on that and something that could be done? Sure. Absolutely. That's fantastic, and I think that's a step forward, so why don't we go ahead and write that down. I'm going to go ahead and get started on assessing you, which is, I'd like you to think, obviously, at this time, again, my last warning to you, bringing up something negative, I'd like you to think of a memory, something that has happened or affected you to the point that you would like to move on from or replace with something a little bit better when it does come up. So, can you think of that? Can you hold this thought for a moment? Absolutely. Now, can we identify why this happened? Why do you think that this situation happened? Well, a lot of people blame themselves for memories such as that. However, I do want to point out that is a very common response for certain trauma. This isn't something you have to understand, to really worry about. We're just looking right now to replace this memory. However, I do have to ask, so you do believe? Okay, so I do have to ask why. I mean, that's just a common question. Sure, I definitely relate. I want you to feel completely valid in your answers and your response, and I completely agree. So I'm going to go ahead and have you keep this thought in your head. I want you to keep essentially not the what, the whys, the images, things like that. I just would like you to keep a soul memory of this event in your head. The feeling of it is very uncomfortable, and we're going to go through and just do a quick physical assessment. I am going to use gloves for this. It's very quick, and then we're going to start the desensitization. Now, you're probably wondering, what am I doing physically assessing you? Well, we can go ahead and start with a little bit of hand sanitizer, and I can work on that. I'm physically assessing you so I can look you up and down. This is called a body scan. I can see the way that you feel, the way that you're physically acting now compared to when we do the desensitization and then the review after. I would like you to rate this memory on a scale from 1 to 10. Your feeling of it on a scale of 1 to 10. I'm just going to write that down while I'm over here. Okay, so how do you feel of the event from 1 to 10, 10 being the worst? Okay, and also from 1 to 10, what I have. Okay, excellent. Alright. Yes, I am putting on hand sanitizer to apply gloves. I do understand the kind of craziness in that, but how far can we possibly see? So, do you mind if I just touch you around the face very quickly? I'm just going to place my hands on the sides of your head, and I am going to do a little test. And essentially that test is me just asking you how you feel about certain sounds, and so on. So that is okay. I do have consent to touch you. Excellent. Thank you. So I'm just placing my hands and feeling how you move at the moment. Can you go ahead and tilt your head to the right for me? Can you go ahead and tilt your head to the left for me? Fantastic. Okay. Good. Alright, can you go ahead and look down? I'm going to put my hand right up against you. Right here, very, very gently. Gently. Ever so gently. Okay, can you move your head forward a bit? Super, super fly. Alright, and I'm just going to place my hand on the back of your head, and I just want you to move back towards my head, okay? Kind of like a cranial nerve examination, if you will. Go ahead and move your head back for me. Fabulous. Alright, that's pretty much it. I'm going to have you raise your shoulders, and I'm going to hold onto your shoulders. Can you raise your shoulders for me? Press against. Press against. Excellent. Again, that was just to see your body reactions, how it's functioning at the moment. So at this point, I am going to start the desensitization process. We've done your units of measurements to see how you feel about the situation. We've done a physical assessment, went over your treatment plan, and I believe we are ready to proceed. So essentially, all this is, as I'd mentioned in the beginning, is I am going to be doing what's called eye movement desensitization and reprocessing. I'm going to be doing certain sounds and hand movements and having you focus on those sounds and movements as I have you review the memory of the trauma that you've been through, issue that you've been through, something you want to work through the entire time until you can focus or associate the positive sound with the negative memory. And what that secured. Excellent. Here we go. Stay focused on my face at this time. I want you to follow my fingers here, my 2 fingers. Just go ahead and follow them. Okay, focus on my face. Focus on my face. Follow my 2 fingers. Focus on my 2 fingers. Follow them. I want you to continue replaying this memory in your mind, okay? You're going to focus directly on my fingers and the sound is going to change, okay? The speed will pick up. Focus on my 2 fingers. Fantastic. Focus right here. Focus right here. Focus right here. Follow my 2 fingers. Follow my 2 fingers. Focus right here. We're going to do a quick assessment. Go ahead and breathe. Go ahead and kind of scramble the mind. We're going to just kind of check in, see how you're feeling. How are you doing at this time? Are you comfortable continuing? Or a little bit more, a little bit left? I've kept the sounds very gentle, very minimal. Kept hand movements and following going to proceed to get a little bit more quick in my movements and directions. So with that being said, if you're comfortable, we can proceed. Focus right here. Follow my fingers. Focus right here. Right here. Focus right here. Right here. Right here. Focus right here. Follow my fingers back and forth and back and forth and back and forth. Listen closely and focus right here. Listen closely and focus right here. Right here. Focus right here. Focus right here. Right here. I want you to focus in the palm of my hand right here. Focus in the palm of my hand right here. Focus in the palm of my hand right here. Focus right here. Focus right here. Good. Can you follow my fingers just very briefly? Where they pop up, follow my fingers. Can you look right here? Right here. Okay. How are you doing? How are you feeling? Okay. I'm checking in. It does seem like the intro process is much longer than the actual desensitization and reprocessing. I am going to finish up now for a moment or two. It does get more chaotic, but at this point, I would just like you to kind of follow my instructions without focusing much on the memory. And I'm going to have you rate yourself on a scale of 1 to 10 once we finish. So, are you okay to proceed and finish? Absolutely. Alright. At this point, I would just like you to follow one finger back and forth. Just follow one finger back and forth. Can you follow this finger up and down, 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 up and down. Follow my finger left to right, left to right, into frame and out of frame. Left to right, to left to right, to left to right, to left to right. revisiting this memory very briefly from a scale of 1 to 10, 10 being the worst, 1 being the lightest. I'm going to go ahead and grab your chart. We have finished. I do want to review how you're feeling. I want to take a few deep breaths. Just relax with me. We don't have anything we need to do at this moment. Again, I booked or finished the day so I can focus directly on you. And again, about the memory itself, on a scale of 1 to 10, can you also rate? That's what I'd like to hear for our first session. Before we wrap up, I would like to always leave these sessions by installing a positive belief in your mind that going forward, this is possible. And just because things don't happen overnight don't mean they don't happen at all. Time can be our greatest enemy or our best ally. It just depends how we treat it. And as long as you have a safe space and a comfortable position with somebody, it can get better, and I think with that rating, it will. At this time, I'm just going to go ahead and put on one glove. And I'd like to do a brief body scan again. Just to see that despite your verbal ratings, your physical ones are also matching. So I'm just gonna go ahead and come closer and put my hand directly on your face, okay? Can you press forward and just hold? Good. I'm gonna put my hand behind you. Can you press against me and hold? I'm gonna put my hand to the right of you. Can you just lean against me and hold? Good. And then I'm just gonna put my hand from the back on the left of you. Can you just lean your head against me and hold? Beautiful. What about if I put my hand on this shoulder and have you lift it, and can you hold? Fantastic. And then if I put it on the other side and you lift it against me, can you hold? Beautiful. Last but not least, I am going to just place my hand on your chest. This is just a quick heartbeat, but it also lets me feel how hard it's pumping, etc., etc. This is kind of much better than using the stethoscope, don't you think? In and out and in and out. Hold. Absolutely beautiful. You've done fabulous. Alright. So at this time, just taking a moment to breathe, is there anything you would like to tell me during this session that we can work towards for next session? Any feelings that you might be a little bit vulnerable getting out, you can keep to yourself, or if you feel comfortable enough sharing with me, I am listening at this time. Well then, my dear friend, I would like to tell you, you have completed your first eye movement desensitization and reprocessing. I know that our first session, prepping, doing all of the steps, kind of defeats the purpose of the very short time, even a little less than 10 minutes of the process itself. However, I can assure you, as our sessions go on, they focus longer on the reprocessing and the desensitizing than it does on the prep. I just wanted to get to know you a little bit today, and I think we made brilliant progress, if you ask me. Is there anything I can get you at this time? Water, tea, coffee? Are you hungry? Do you want to take a little bit to rest and close your eyes? Absolutely. Well, looking over this properly, I think you are finished. I'm going to go ahead and finish some notes and put them in your chart. I do believe when you are ready, you can get up and leave yourself. Take your time, take a few deep breaths, as you feel comfortable. It was very nice meeting you, and I look forward to our next session. Absolutely.